fellowship of the great physician welcomes you to House Call. Our hosts today are doctors of chiropractic, Dr. Gerald Bala and Dr. Richard Jensen, who is also a board-certified acupuncturist, practiced independently in Shoreview, Minnesota. Let's join our hosts for today's program that will assist you in your quest for optimum health and well-being.
Welcome to House Call. I'm Dr. Gerald Alla.
And I'm Dr. Richard Jensen.
Great to have you with us in this dimension of House Call. As the announcer said, we're doctors of chiropractic, and our program today is about whiplash type accidents, what can happen, and I think you'll find it very interesting. It's certainly an interesting subject for Dr. Jensen and I and our clinic staff as we, over the years, what do we have, probably over 60 years of experience in practice, private practice, and there's a tremendous focus and interest on our part of taking care of people who have been involved in whiplash type accidents, including automobile accidents or collisions, workers' comp injuries, boating accidents, and things of that nature. And so I think you're going to find this very interesting. And for those of you are not familiar with Shoreview, Minnesota, it is the gateway to the north coast of America. Shoreview is a northern suburb of the Twin Cities. Probably the nicest suburb that you could ever visit or live in. Has lots of parks and open land and just a great peaceful type community to live in. And so we invite you to come here. There's easy access to where we are in Shoreview, or between Highway Interstate 35W and Interstate 35E. So it's really simple, and come and visit us sometime. We'd be happy to see you. So, whiplash, Dr. Jensen, my esteemed colleague, is going to show you some beautiful slides of what very often happens to people when they're in whiplash-type injuries. Many times they do not have symptoms. They do not have initial symptoms. Sometimes the injury is masked by endorphins, painkillers, and they say, gee, I may have a little stiffness, or I feel real good, or maybe they're afraid that their insurance company is going to, car insurance is going to drop them, which they legally can't do unless there was fraud or something of that nature. And many times when those issues aren't looked at initially, they develop into some real serious problems later on, of which their insurance doesn't have to be responsible for in most cases. So Dr. Jensen, well, let's take a look at it, okay?
Okay. Thank you, Dr. Lala. Well, as we look at this first picture here, we're looking at, with a whiplash, we have a forward casting of the head and then a backward casting of the head, which creates this whiplash type of injury, or as we would call in our profession, hyperflexion, hyperextension injury. And so here what we're looking at is the side view of the neck and really at the ligaments in the neck, and what can happen on the forward casting of the head, as we'll see in this picture. When the head gets pushed forward, we can end up with a
go ahead.
Yes, we can end up with a tear here in this ligament here.
So from the law of physics, if they're struck from the rear, if you put your pointer up there, huh?
Okay.
If they're struck from the rear, the law of physics, the object goes to the force, correct?
Right.
So the head goes backwards, and then it's thrust forward. So that's where the term whiplash comes from, right?
Right. It's basically, if you're looking at the laws of motion, the head, I mean, the seat is still pushing forward the body, but the head doesn't have that seat behind it. So when the whiplash occurs, first you get hit. If you get struck from behind, the body is moved forward, and the head actually tries to stay in place, and therefore moves backwards first. And usually this injury then occurs first.
So it would not be unusual for somebody to complain like, I have a sore throat after an accident.
Right.
You know?
Right.
Or I swallow, it's difficult.
Deep
sore throat. Go to the doctor. Doctor can't find anything wrong with the throat.
A lot of times when you're looking at ligamentous injuries also, it's a kind of a pain that you can't just say here or here. It's more of a general kind of sensation throughout the neck. You can't quite put your finger on it. And so therefore they think it's something that's been spread through there. And so your description of a sore throat is correct. It doesn't feel like one spot. It feels like the whole thing.
Well, then if we bring that slide back up, it makes me think of another thing here. So the brain then could be like, what's a good analogy? The brain inside of the skull, like a tennis ball inside of a can or something like that? Or
Sure, if you fill the can with water, then it's even a better description. But that brain will still move against those different areas and can cause injury to the brain as it smacks the backside of what we call the calvarium or the vault, or the brain vault.
So what would some of the common symptoms then, if that brain has been jarred? What would some of the common symptoms be then?
Well, there's cognizant dissonance where they just can't seem to think straight.
Process their thoughts as they previously
Right.
had?
It's not as quick there. You can have some balance problems that are going on. You can have
How about like lightheadedness? Would that be something, or dizziness?
lightheadedness could certainly be there. Well, that could also be due to the neck injury itself.
Headaches?
Headaches can be there.
How about noises in the ear?
Certainly, if ever you have any swelling in the brain, the brain will end up having, should we call a signaling going on within it, and your brain has to then make sense of that, because the brain is an organ that makes sense of our environment, and sometimes we'll even make stuff up.
So it could affect then any of our cranial nerves, such as sight. Our vision could be changed, or smell,
Certainly.
or taste,
Certainly.
touch, or
we can-
balance you were talking
And
about.
we can see where, a lot of times where the brain is unsettled, where it's pushed forward against the front, you can actually have a bruising in the frontal lobes of the brain, which then the frontal lobe is how we make plans, how we determine what our next steps are. So a lot of times people can get frustrated in that they're just not thinking straight as in a logical order of going through the processes of their day.
And so sometimes then that head, when it goes back and hits the headrest, the headrest could aggravate it, or if the headrest is not in proper position, it could actually make the trauma worse. And
It can make the trauma worse for the neck, or have it in a place where it's keeping the head in place, where if the change in position is fast enough or rapid enough, the acceleration or deacceleration of the accident is rapid enough that it could actually start causing some injury to the brain as well as the brain stem.
so it could affect the face then, the trigeminal nerve.
Definitely.
Could affect the jaw, bite. Could affect the teeth, huh?
You feel it in the
You
teeth,
could
definitely.
start having tooth problems.
In fact, the trigeminal nerve, we have the trigeminal nerve, it goes to 3 areas, okay? And in the 3
I
areas...
guess that's why they call it tri, huh?
Trigeminal. Yeah, and when you go in, you have dental work. Many times if they're trying to numb the teeth in the bottom, they will put Novocaine in here and put Novocaine in here, because the trigeminal nerve actually comes across the face and crosses over a little bit, so the front teeth might feel it from both sides.
So then, if a person is in an automobile collision, for example, or some kind of accident where the neck has been jarred, of course, if the neck and head are jarred, it's going to affect the rest of the spinal cord too. But that means that they could have any of these things we're talking about. Therefore, because of these endorphins, they may not have symptoms that they're identifying, or they may be taking some over-the-counter analgesic or maybe a prescribed medication. So therefore, they should go to a medical doctor or a chiropractor who does a cranial nerve exam,
Right.
not just look at the spine.
Right.
But many times we just kind of slough them off. Not you or I, but they're
Right.
kind of sloughed off, or the
Right.
chiropractor is just interested in getting them on the treatment table. And of course, then the massage therapist, who isn't qualified whatsoever to even take a history like that, let alone do a cranial orthopedic and a cranial neurological workup, a lot of these things are then missed, are missed, right? And so anything that's missed sets up reverberations for worsening health problems later on.
Definitely, definitely. And one of the things that we always do in our clinic is we look at a gait analysis. And it's interesting where you can see the gait, where a person will start to walk in the walls and things like that on their way down, almost like an ataxic gait, where the accident has messed up their cerebellum, because of that has to do with coordination. So their speech and things like that can change.
I know in seminars that we teach for licensing of chiropractors, for renewing of their license every year, one of the things that we do in subjects just like this that we teach is we encourage those doctors to have a digital camera in their office, and then to do a gait analysis of that person walking down the hall and back and recording that on a digital camera, right?
On a camera, yeah.
And many times you'll see that their gait is off, but they're not necessarily having symptoms or anything like that. Therefore, if you're, I think if that's my professional opinion, and I have a right to give that opinion, and we tell these chiropractors, look, if you're not doing a digital gait analysis, it's one thing to do a gait analysis, but it's another to record that and then study that on
your television.
On a television screen, like we have the monitors in our clinic to do that, and to see how that person's gait is. Just as much as we record, something we're going to get into here now, it's one thing to record these things and have them as documents, and then also, as we talk about palpating, as we're going to look at this slide again, palpating the spine, and then checking the ranges of motion, which are so important. So Dr. Jensen, you've got that slide up there again that I interrupted you with about 7 minutes ago.
That's fine. That's fine. So what we're looking at is first, as we talked about, the mechanism of injury, where we can have ripping and tearing of the ligaments in the back and the ligaments in the front of the neck. So it's not just not just an injury to one side. It can go very deep as well. And therefore, it's very important for us to take x-rays, because the swelling in this area will show up on an x-ray too, where we can see where it's going into the airspace
Right.
of the x-ray.
You make me think, as we look further down here, we see the clavicle there and part of the scapula. And an upper rib, I think, is on the bottom, isn't it? And so a lot of these people, look how close
Here's
the
the ribs.
Ribs. There's a
Scapula, that's the shoulder blade.
Shoulder blade.
And then the collarbone.
Right. Now, a lot of these people who have been in whiplash accidents will start having chest pains or shoulder pains or collarbone pains later on, just as much as they're up by the jaw. Those neck muscles are related to our bite. And so very often they'll end up with temporomandibular issues as well. And the only way, there are some chiropractors who don't x-ray at all. They think they have x-rays in their hands, which is a ridiculous statement. And so we can see the location of those bones and those discs and those muscles and ligaments, but then sometimes we'll refer them out for an MRI, which is going to show us tearing, right, and things of that nature. So please, I would say that from the depth of my heart, please don't let a chiropractor, a massage therapist, or physical therapist treat you without a good neurological workup, a good spinal workup, not some little kiss and run thing, just and get you in the x-ray room, or to treat you without adequate x-rays. And even in our seminars, we have what are called a footprint of x-rays for different conditions. And if there's any shoulder, arm, or hand pain, for example, or lower extremities pain, there should be additional x-rays made. And these are all classical things within medicine has identified those, and scientific chiropractic has identified those throughout the years. And so if you've gone to a chiropractor and they're just making a full spine x-ray of you and that's about it, or one little picture of your neck, in my professional opinion, there's a high propensity there that they may be not adequately diagnosing you or adequately doing the tests that should be. Or if they're taking a neck x-ray of you from the front, it's supposed to be one with your mouth open and another with your mouth closed and then with your neck turned from the side. Now, if there's numbness or tingling in your hands, then they need to do what's called a Davis series as well. And many times they're not doing that. And that's a disservice to you. It really is.
One of the things that we look at is as chiropractors, a great deal of our training is in manipulation or adjustments of the cervical spine. But a great deal of that education is also when not to adjust and how to assess x-rays to see what the structure is in there. And if we weren't supposed to do that, why would they give us so much education in it? Here's another thing: is if you looked at this slide again, as we bring that up, you can see these little levers on the back of the spine. Well, if you look at a tree, not all the branches grow straight out and in order, and a lot of times these things will generally grow straight out. But if you looked at it from the backside, sometimes these things curve to the side, and that they've grown that way. Now, if I go in there and I try to palpate with just my hands, and looking at that and saying that a bone is out of place from that, and it's naturally curved, what's happened is in the assessment with just using my hands, I'm going to say that that person has a misalignment in there, and I'm adjusting a spot that's not misaligned over and over again, because it's always going to present as though it's misaligned, though it's not really. And it's the x-ray that determines between those two. The other thing is there's a thing where some people grow ribs up into their neck. And so it's called a cervical rib. And that, if you palpate that, is going to feel as though that bone is misaligned because there's extra bone there.
And we see that many times as we see, unfortunately, a significant number of people who have already been to orthopedic surgeons, neurologists, a regular family medical doctor, and chiropractors, and physical therapists and massage therapists. And very often they haven't been x-rayed.
Right.
Or if they have been x-rayed, they've not been adequate x-rays, or if they've been x-rayed, they're poor quality x-rays. And very often they miss these cervical ribs and these issues. So if we bring that slide up here again, you make me think of something. Normally, when we look at a person from the side like this, they're supposed to have a slight forward sway in their neck. That's called a cervical lordosis. Now the skull, you can envision like the globe of the world, and it sets on the first cervical vertebra, called the atlas, and you can envision that as Mr. Atlas holding up the world. Well, the reason that that forward sway is normally in there, it's supposed to be normally in there, is that gradually, those vertebrae gradually disperse the weight of the skull. Well, if that, very common in neck injuries of any kind, especially from the rear, they lose that normal forward sway.
Right.
And they may go to a chiropractor, massage therapist, or physical therapist, get some treatments and say, well, I'm fine, or the insurance company says, find some doctor to say there's nothing wrong with them anymore to cut off their care. But many times, instead of having that normal forward sway here, the neck becomes ramrod. It develops over a period of time a ramrod or a military neck like that. And so that weight of the skull can't hold. That neck no longer disperses the weight of that skull, and then they end up with these chronic problems.
If you go to my camera here for a moment, I'm going to illustrate this. If you have that curve, like I have a curve in my finger, and I put pressure on this, see how it's able to take that. Now, if I put that straight, now that jamming is going all the way down to this joint. So we're talking about a dispersion of these forces in normally curved. Now, there's also a difference between the kinds of x-rays that are being taken. If you're looking right at a cervical x-ray where the x-ray beam is going through here, where they're just taking a picture of the neck from the side, they can see this much better because it's a better representation of it. But if you're taking a full spine x-ray where they're trying to take all the way from the pelvis on up to the neck, rather than that x-ray beam coming up through here, it's coming down through here through the mid-body. And so the rays of that x-ray is coming up this way. And if you do that with anything, looking at it from an angle, it's going to look straighter than it was before. So many times, those full spine x-rays rather than sectional x-rays is going to make it look as though there's a loss of that normal curve, and therefore you need treatment. But it's a trick of the x-ray.
Well, it's a trick of the chiropractor. It's a trick of the chiropractor misusing the x-ray to make the patient think their spine is...
I'm going to give them a benefit of a doubt and say it may be an honest mistake of the x-ray.
You and I know that there are systems out there going on in chiropractic where they're using gimmicks like that.
Certainly.
And you can't, even though the insurance companies and we can't name somebody or something like that because it'd be irresponsible professionally, but the insurance companies know they may not want you going to a chiropractor. You know, they may not want you going to a chiropractor because it's supposedly going to save them money, but they still know who the good ones are. They still know who the good ones are, who do good diagnostic workups. They know the ones who make good quality x-rays. They know the ones who keep good chart notes. They know the ones who do good report of findings and re-examinations. But they can't legally say which ones are the good ones or the bad ones, and so do the attorneys. And so just as much as there are good surgeons and not so good surgeons, it doesn't mean that you can wipe away the ones that are not so good. They can still practice as long as there aren't many they haven't been caught with a lot of violations. So it becomes just as much as if you're finding somebody who's got this great personality, great salesman, great salesman or saleswoman, you can almost, or there's a high likelihood that they're probably not a great surgeon or a great chiropractor or a great physical therapist, because they're using personality very often to overcome their lack of scientific credibility, right?
Very possible.
Very possible. Highly possible.
Highly possible.
So,
but I'm not going to put them all in the same.
no, we're not.
No.
Just saying that there's good care and there's not so good care.
Right. Right.
All right. Well,
And so we're looking at this next slide. We have a picture where it brings up closer into the ligaments, and the ligaments are actually the generator of a great deal of pain in the spine, where we have the interspinous ligaments, okay, and we have the posterior longitudinal ligaments.
So you're looking,
anterior longitudinal ligaments.
Anterior is the front of the neck now, the front of the
Right.
vertebra.
Right.
In between those white areas are two discs.
Yes.
Right. So there's an anterior longitudinal ligament. That's a ligament that can be injured.
That comes all the way across here. That's the one that we saw in the front of the neck that was ruptured.
And then there's the disc.
Then there's the
And
disc.
what are those black holes there?
These holes here are actually holes in which the tunnels, if you will, in which the nerves, arteries, lymphatics, veins, and all that travel out or in
From the spinal cord.
From the spinal cord.
Okay.
Okay.
And then what's that white area behind it there?
Then you have the posterior longitudinal ligament,
So there's
and that can also be ruptured. And when that's ruptured, that can also put pressure on the spinal cord inside.
But it could be torn too, right? Strained or sprained?
Yes,
Okay,
it may.
Then what's those things there, the spinous process from the
Right
side?
here is the bone. That's that lever that I was talking about that may grow off to the side or so forth too. And then back here you have the interspinous ligaments, which may be torn also.
So you visualize the back there would be the top, the head would be on top, right?
The head would be on. Right.
And the force comes from the rear if it's a rear end accident.
If the force comes from back
And
here,
it
then
whips that
first you get
forward.
the injury back up here.
Goes,
And then as the car stops again, or the head will flip forward and cause an injury back here.
And it very often takes, if there's not been any initial tearing or something like that, it may take weeks to months for those ligamentous and bone injuries to become manifest as symptoms.
Yes, definitely. And when you look at, I just lost it.
So if you don't have an x-ray of the area, you really can't tell what's happened inside of there.
No, I mean there's clues that you can have, but it's not necessarily. Here if you look at this tissue here is actually the ligamentous tissue is actually stronger than bone. So many times what you can have is that the ligaments will break the bone, and really the body is designed that this would be stronger because these ligamentous areas do not have a blood supply to them. They kind of get it from infusion from everything else, whereas the bones have their own blood supply. So if you look at the process of healing, muscle has a great deal of blood supply also. So a lot of times a muscle injury will heal very quickly. Okay. Then you have bones. We know they put a cast on, and 6 weeks later, it's like you didn't break the bone, right? And if nothing else happened to it, but the bone heals within 6 weeks. If you look at a sprain, like a lot of people sprain their ankles, that sprain will happen. That a lot of times it'll take up to a year for that to really get back to normal. So when you're looking at this, the body is designed to try to sacrifice certain tissues before other tissues in order to help save itself.
Well, what does the next slide then show us? I know there is going backwards. It's going to the force now. If there was a rear
If it was a rear end collision, It would be going towards the force with a hyperextension is what they call it.
So if it was a front-end collision, the head would go forward. If it was from the side, right or left side, it would go to the side.
To the side.
And if the head was turned either way at the time of collision, that even complicates it even more.
Yes.
But then if I don't ask in my initial case history, what was the position of your head at the time of the accident, I'm missing a vital component or aspect of determining possible injuries.
You look at it, the accident, there's usually it's more of a complex kind of accident than just the simple accident. From the point that somebody gets rear-ended. Many times they're at a corner, they're getting ready to take the turn, and their head is completely turned looking this way to see if there's any oncoming traffic. And that's when they get hit. Maybe they rolled forward a little bit and somebody came up, oh, they're going to go, and so they started to look and went forward and hit somebody.
In essence, they'd probably be better off if another vehicle isn't in front of them, if their foot wasn't on the brake, because at least they would go forward. But if their foot is on the brake, they're stopped, then that force goes boom. It's not really released, is it?
Right, and then it also, we were talking about in one of our other shows, this auto accident checklist, and if you don't have it, please call and ask for it. It helps you to document these kinds of accidents, and one of the things is from the make of the car, it can certainly, from the translation of the forces to the car, it may transfer more force to the person than not. And it depends upon whether the car, you get into some technical terms of being an elastic or inelastic collision, whereas a car being hit, say, at 5 miles per hour, will end up traveling 9 miles per hour, depending on how the car and how it distributes those forces and returns those forces back, actually accelerates the car faster. So then the accident is more of a 9 mile an hour accident. And what has happened is that the duration over the hit is much quicker than say, going into a crash mat or whatever. That's the whole thing about airbags, is to distribute that force over time rather than having an instantaneous kind of accident, which is much, much worse.
But still, if the airbag is released, it certainly keeps my head from hitting the windshield or the dashboard. But then still, I mean, people think those are soft little airbags. They're not soft. I mean, you're going in there. So actually what it does is the head goes like this, and then it whips it back.
They are inflated by an explosion or a rocket, if you will, that they are there now. And a lot of times it's hot. So you can have those hot gases there that are stopping you. But the thing that it saves us from is many times the steering wheel, what it did was it came across, sorry about the mic, guys, it came across and hit the sternum and can separate the sternum. There's a bone called the manubrium and the sternum. And at that separation, it came back and it can sever the aorta from the heart. And within that, it's like instant death because you got the heart pumping into nothing. That main vessel is gone. And so that's what a lot of those steering wheel accidents had occurred before they had the airbag there.
So everything we design that works good still has potential adverse effects. It's like drugs. There isn't a drug created that doesn't also have possible adverse effects, right?
Sure. The only sure way is to have abstinence from accidents.
Well, if you've been involved in an automobile accident or some kind of collision, we'd encourage you to get yourself checked out by a chiropractor who has a good reputation, somebody who's very serious, and their practice is based on science, not personality, and does a good diagnostic workup. And very important, for your body is the only body you're going to ever have, and you may have an injury today and it may seem insignificant, but it can have long-term adverse effects if it's not correctly diagnosed and treated now.
House Call has been brought to you by the Fellowship of Great Physicians.